Finding a doctor can be hard for anybody. It's hard to find a good doctor. You want someone who's knowledgeable, you want someone who cares, you want someone who's good at what they do, you want someone who's going to make sure you stay healthy. As a trans man, or a trans person in general, it's even harder to find a good doctor. A lot of doctors, especially depending on your area, are not very knowledgeable on the transgendered body. They don't have a lot of experience. Some can be really ignorant. It's a risk. It's a risk to go to the hospital sometimes. It's a risk to it's risk to even go to the doctors. You don't really know how you're going to be treated. You don't really know, if they're going to be able to help you. You don't know if you're going to get proper medical attention. So there's all these factors, and so my doctor recently retired, and I had to find another doctor. I'm all about taking care of my health, so I get physicals every 1 to 2 years. I think that's super important, and I was recommended to a doctor by a friend of mine. I put in a group. I actually tried to Google too, and I couldn't find anything on Google for transgendered or even LGBT friendly doctors in my area. I did find sites, and maybe like for other states and stuff to search where people can like write reviews, but I didn't find any in my particular area. However, the great thing about the internet is you've got all these groups that connect people from all over the place. So I'm in a couple Florida groups I posted out there. A friend of mine recommended this doctor. So I go to him for my physical. First time meeting him. And so I tell him, the nurse or whatever, she comes in and she's getting my information, any medications, any surgeries. So I'm like, yeah, I'm on testosterone. At this point, I hadn't said anything to anybody that I was transgender, but I said I'm on testosterone. Named my surgeries: it's a mastectomy, hysterectomy. So it's probably pretty obvious when I say those things, right? So I said that. She was cool. She didn't really, say anything. Just did her job, asked the questions, put in the information. Doctor comes in and she says, just get undressed, you can keep your undergarments on, but get undressed for the doctor. And I haven't had a physical in a while, so I don't even know, what like the standard procedure is anyway, other than blood work. But so I'm sitting in my boxers, the doctor comes in and, he's like, is there anything I should know about you? That was the first thing he asked. So I'm like, well, I'm transgendered. So he kind of I don't know, he was really looking me up and down, I feel like, he asked me about surgeries. He asked me psychological questions. Oh, your family cool with this? You feel good? And some of that stuff was kind of questionable to me. And that's the thing. To me, it's like, when is a person being curious? Or when are they crossing that line of inappropriateness? But a lot of doctors these days actually have a lot of psychological training. And at the MCATs, actually, which is what you take if you want to go to medical school, has a lot of psychology in it now. So I think doctors are really also trying to be trained more to, know signs of depression and, just be more aware of the client's psychological health. And he also seems really, he asked me, he's like, you see a dentist, you see an eye doctor. So he seemed very well-rounded. So I didn't take that offensively, or him being nosy. He did, again, he asked about surgeries, asked how much testosterone I was taking, asked me, exactly what all surgeries I've had. Now I'm sitting on the table in my boxers, and he was sitting in a chair. So we were not at eye level, and he didn't really make a lot of eye contact. He didn't seem to me like I think that's just his personality. Some people don't make a lot of eye contact. But I did feel like he was looking at my crotch area, and it could have just been from the angle, but he seemed, he admitted that he doesn't really work. He could check levels or whatever, but my endocrinologist is going to do that. But he's admitted he doesn't really work with any transgendered people or many transgendered people, I guess. So he wasn't too knowledgeable on stuff regarding that. But he was happy that I was working with other specialists. So the endocrinologist is going to do my testosterone, check my levels and all that. But other than that, like just being kind of awkward in that sense, it was really cool. He seemed like a really nice guy, compassionate and educated. He told me that in terms of the thyroid testing, because this was my physical, so blood work for the thyroid, that's typically only done in females. And he didn't see any need to do that with me. If my endocrinologist wanted to test my thyroid, he could. But he was going to do a physical for a 34-year-old male, and he didn't see any reason to do it any other way. So that was cool. And, it's like I said, it was hard. It was awkward at first and hard to, I guess figure out his standpoint. But he seems like a good doctor, and he seems respectful. And when it comes to finding a doctor, that's really what's important. So you can choose whatever doctor you want to go to. You can choose other doctors if you don't like your doctor, if you don't feel you're getting good medical attention, and if you don't feel comfortable. Don't go to someone who makes you feel uncomfortable. And whatever that line is for you, that's where it's at. And that's the most important thing. So if you're transgender and you're trying to find a doctor because taking care of your health is super important, guys, it really is. Go on groups, ask around people in your area. I think word of mouth is one of the best things. They've already experienced it. They've enjoyed the experience. I think that's a great start. And then, educate your doctors. It's kind of a cool spot to be in because we get to educate our doctors and they get to learn more about the transgendered body, and the more they learn about that, the better they're going to be at medicine and practicing medicine regarding our body, because it is different than a cisgendered person. So he also complimented my chest, Dr. Garamoni. So no more shirtless stuff, but you guys have seen my chest. And yeah, that's it. So if you have any questions regarding anything, drop it below. If you want to know more about my experience working, with, dealing with doctors or whatever, or if you have any questions regarding medical care, maybe I can answer them. I don't know. Drop a line down below. And again, if there's a video topic you want me to discuss, drop it. I'll discuss it. Let's talk about it. Let's do it. I think I am going to make another more raw, emotional video about Orlando because it really is very upsetting to me. But I'm not sure if I'm going to do that. So, yeah. And I wish you guys would leave more comments and have a discussion with me. Some of you do, but a lot of you don't. I wanna have conversation. So let's do it.